This is the CJSON podcast, and I'm Dr. Koki Hattori from the Department of Nephrology at Osaka University Graduate School of Medicine. I'd like to share with you some findings about eosinophils observed in the kidney biopsy tissues, shedding light on the previously overlooked phenomenon known as interstitial eosinophilic aggregates. Eosinophilic infiltration in the kidney has been considered a rare finding in certain etiologies, such as drug-induced tubulointerstitial nephritis. However, some previous publications reported that interstitial eosinophilic aggregates are actually observed in the wider spectrum of kidney diseases. In addition, interstitial eosinophilic aggregates are known to be correlated to interstitial fibrosis and tubular atrophy. Our analysis takes it further, examining whether interstitial eosinophilic aggregates are associated with the kidney outcomes. We retrospectively examined 563 kidney biopsy samples obtained in our hospital from 2009 to 2021. 70% of these cases shows interstitial eosinophilic aggregates, mainly in the cortex. These eosinophilic aggregates exist in the various kidney diseases, including diabetic nephropathy, IgA nephropathy, and nephrosclerosis. During the median follow-up 3.6 years, a complete kidney outcome of the initiation of kidney replacement therapy or eGFR decline of greater than 40% occurred 3 times more in the patient with interstitial eosinophilic aggregates than in those without interstitial eosinophilic aggregates. After much variable adjustment for demographic variables, eGFR and urinary protein to creatinine ratio, interstitial eosinophilic aggregates were significantly associated with poor kidney outcomes. This association remained robust after the further adjustment for histological scores. Further, we identified that blood eosinophil count was the strongest predictor for the presence of interstitial eosinophilic aggregates. In the second part of our research, involving nearly 3,000 patients with advanced CKD, we examined the association of blood eosinophil counts as a surrogate marker for interstitial eosinophilic aggregates. We demonstrated that a higher blood eosinophil count was associated with poor kidney outcomes. So, what does this all mean? It suggests that interstitial eosinophilic aggregate could serve as a histological marker for kidney prognosis. That's the gist of today's post. Thank you.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.